The stroke that works on the orbicularis muscle, which is that circular around the mouth. You start to squeegee the blood from the outside going in. You do it until you see almost fullness in the lips. It's really an interesting stroke. Most people need this.
Here's your cereal. I didn't put bananas in it. It's got a few raisins. Do you want more raisins or more bananas? You let me know.
All right. Those are 2 strokes, a zigzag jaw hold, mouth pinch, then we go back to milk. I'm just going to simulate it. Milking stroke 2 times on each side. And then again. Then we go to what's called the cheekbone stroke. The cheekbone stroke was similar, is the same thing as we did in a chin full face stroke, but we start here. And we go up like this. So we put the index finger right next to the nostrils there, pushing in, cup the other fingers up, and then just gently mold around and draw up. The next stroke after the cheekbone stroke, which is this, called the nose stroke. The nose stroke starts up here, goes down the nose, and you can revolve each direction. And then up the nose, and up and out to the side. The next stroke after the nose stroke, which again goes like this. The nose stroke goes down the nose, you wrap around the nostrils, then you go back up and gently up along the eyebrows and up. Do that again. Down the nose, go either direction, then come up, gently draw across the eyebrows and up. Then we do the milking stroke, and then the next 2 strokes are called the cheek sweep and the bag remover. The cheek sweep, here's the cheek muscle right here. The cheek sweep is gently sliding the finger up, across that, up to right where the bone stops for the eye socket, and you gently press down. The pressing down part, the purpose is to sweep blood into this area underneath the eyes, which has less vascularity than the other parts of the face. As you can see, this area here is flooded with blood, underneath the eye is not. So what we're doing is milking the blood up, and then gently. It's a gentle stroke. It's not something you really bear down on. You're just uplifting this cheek. You could do it both hands, using 4 fingers on each side by doing this. Now the bag remover is one in which you gently go at the base of the eye socket and just push the blood in just a little pulsing motion around. You don't want to stretch under there, so it's more of a pulse. Okay. The next stroke is the fan stroke, which means that we're going back to what we did the first time, just for a break on the face. We go back down here and do the fan stroke. Part of this fan stroke, you add this part. You reach underneath the back, press up with your fingers to about upper middle back spine, and your fingers on the spinal thalamic nerve tract, you draw up from the sides of the spine, drawing all the way up and straight up. Remember, you'll need more lubrication for that area there once you discover that you haven't done it that low on the back. So you sweep around for the fan stroke now. Then you go to about mid-upper back, press up on the spinal thalamic nerve tract, and then draw up that line on both sides of the spine. And gently stretch the neck. that, it says number 2, milking. We won't go into that. The next stroke after that is called the Einstein. The Einstein was just a stroke that you can do on the face that covers a whole bunch of stuff. Meaning you're doing the platysma on up with this one stroke. You draw up here. It's a complicated stroke. Like that. Let's see if I can demonstrate it. I keep demonstrating it. I'm flipping the muscles up from this part of the hand. I'm having the thumbs stop right here underneath the mouth. I'm gently drawing my fingers up the platysma, up over, and we follow the line with the index finger of the same stroke that we did with the chin full face, which was early in the face massage. Now, the bobsled stroke works this area right here as if it's a bobsled run. You press gently on the bone, right above the cartilage. You follow the bone line around. Gently follow the bone line around, and then up this part right here. Don't go down. It's already going down. We want to draw this area up. We're going along the bone, along this muscle, and then up. It's called the bobsled. Now, we also divide this stroke into a series of strokes which attack this whole area right in here. So we can go all the way over, come up here, and then we can hold it. We can come up over here and hold it. And we can keep going up the eyebrow and going up a little bit and holding that muscle. Now let's go back down. Okay, then you proceed to the other side. Up along the bone, all the way over, and hold up. Along the bone, all the way over, hold up. Along the bone, hold up. Along the bone, hold up. And you can proceed. Okay. Now, that was called the bobsled. The next one is called the eyelid. The eyelid, because of context, you don't want to do this, but the eyelid stroke was one where you dipped your fingers gently into the corner of the eye here and made like little gentle circles. And gently go a couple times with this stroke. Here, then just gently across the eyelids. That's if they're not wearing contacts. That's just to give that part of the eye that kind of feel. Give that kind of look. Okay. The next stroke is a milking stroke, which you already know. The next stroke after that, called the eyebrow stroke, which is like the bobsled, except we only concentrate now on this upper part right here. We want to start training the face muscles to go back up here. So the eyebrow stroke just is a continuation of the bobsled without going up the nose. I'm drawing up and holding it. I'm drawing up, holding it. Drawing up, holding it. Drawing up, holding it. And you can go as many times as you want. And just gently ebb that muscle, set of muscles up. For the other side. The next stroke after the eyelid stroke, after the eyebrow stroke, is called crossing the corrugator muscle. Now, that one is referring to the corrugator muscles which go across here. You go like this, like this, like this, like this. The next stroke after that is, it says milking. You already know how to do that. The thinking stroke is after that, and the splayed forehead stroke is after that. The thinking stroke is called so that you can kind of analyze the face while you're looking at it and do one stroke, which is the simplest, called the thinking stroke. It just goes up the center of the forehead, and you see how it draws those center muscles up. Right in here, all the way up. The splayed forehead stroke, splayed finger forehead stroke is fingers are splayed out. You gently draw up. Draw it up. Okay, that ends what's called the phrase rejuvenation part, and that takes about 25 minutes. Then what's called the recontouring part has these strokes. Chin milking. Marilyn Monroe stroke. She had a double chin when she was 24. Didn't get the part in Blackboard Jungle. The director said, if you take 3 weeks, go to these people, who were the people that dealt this, you'll get your double chin off, and you can get a part. That's how what she had to do, was go 3 weeks to these people who did stuff like this to her chin, to bring blood into the fatty tissue here, and also exercise underneath here, and it makes the skin hold tighter around the chin. The other strokes you do, flutter stroke. Flutter stroke is for this area here that drops first in females, right in here. And all it is just milking this muscle up.